Patient is a 63-year-old male who presents to the emergency department with a chief complaint of difficulty breathing when walking for the past 10 days. He says that rest helps, but walking or climbing the stairs makes it worse. He's had prior episodes like this before, but they've never been this persistent. And he said that they've been getting worse and worse since they started. So worse that the past 2 days he hasn't even been able to leave his house. He says that he's gained 5 to 7 pounds the last 2 weeks. He's noticed swelling on both of his legs. He's had orthopnea, and he's gotten up at least 2 times this week gasping for air. He denies chest pain, palpitations, lightheadedness, dizziness, cough, sputum, fever, chills, and sweats. He has a past medical history of hypertension, diabetes mellitus type 2, hyperlipidemia, and stage 3 chronic kidney disease. His father passed away at the age of 70 due to a myocardial infarction, his mom at the age of 74 due to a stroke, and his brother is 65 years old and also has hypertension and type 2 diabetes mellitus. He's taking lisinopril, metoprolol, atorvastatin, metformin, and aspirin, has an allergy to penicillin, but it causes a rash. His blood pressure was 148/88, heart rate was 102, respiration was 22, temp was 98.2, but his O2 was 91% on room air. He was alert, orientated, sitting comfortably, and not any acute distress, but he was mildly tachypnic. He had tachycardia with regular rhythm, S1 and S2 were present. He did have mild neck distension at 45 degrees, not at 30 though. He's mildly tachypnic with bibacillar crackles on auscultation, but no wheezes or rhonchi. His abdomen was soft, non-tender with mild distension. He had 2+ dorsal pedis and posterior tibial pulses bilaterally, and 3+ pitting edema of both bilateral lower legs to the mid-calf. He was alert and orientated ×3. His BNP was high at 78, glucose was high at 156, BUN was 34, and his creatinine was 1.8 with a ratio of 19.1, which was a little high, and his sodium was 132, which was a little low. His x-ray showed cardiomegaly with pulmonary vascular congestion and mid-bibacillar interstitial edema. His EKG showed tachycardia with 102. I'm going to diagnose him with acute decompensated heart failure for now. I'm going to admit him inpatient, watch his O2, continue to monitor the rest of his vitals, watch his ins and out and his weight. I'm going to give him and put him on oxygen for his tachycardia. I'm going to restrict his fluid, put him on a low sodium diet. I want to give him an IV diuretic, probably furosemide for that fluid overload. I want to get an echocardiogram to confirm if it's heart failure, reduced ejection fraction. I want to get a urine analysis and HB1AC to see how his diabetes is doing, and also get a BMP. I want to consult cardiology and maybe nephrology or GU for the chronic kidney disease stage 3 and because of his BUN creatinine ratio. But yeah, thank you.